Welcome to the Wilmot Cancer Institute's Hereditary Cancer Screening and Risk Reduction Program. In this video, you'll learn a little bit about cancer genetic testing and things to consider before deciding to be tested. At a genetic counseling appointment, a genetics provider will go over your family's history of cancer and discuss your risk for developing cancer. Your history can tell us if you qualify for genetic testing or extra cancer screening. It's important to know that speaking with a genetics provider does not mean you have to undergo genetic testing. Some people may be more at risk for certain types of cancer than others due to genetic traits they were born with or their inherited DNA. For this reason, you may qualify for genetic testing. The test is done with a blood or saliva sample. These tests can predict who may be at risk of developing cancer and why. The one main advantage of testing is that it allows you and your family to know ahead of time what your cancer risk may be and what actions you can take to lower that risk. The results of genetic testing may guide when to start cancer screening tests, like mammograms and colonoscopies, and how often they are done.
What causes cancer? There are several possible causes of cancer. Most cancers occur randomly over time as we age, or from exposure to different things in the environment, such as sunlight, radiation, chemicals, or drugs and alcohol. This is sometimes referred to as sporadic cancer. Hereditary forms of cancer are less common, occurring in about 5 to 10% of cancers. This involves an inherited change in the DNA that can be passed down in a family from one generation to the next. In these families, certain features can be observed. For example, there may be multiple people in the family with cancer, or a cancer diagnosed at a young age. Other families can be described as having familial occurrences of cancer. This involves clustering of cancers in a family, but an inherited genetic change being passed down in the family cannot be identified.
What is inherited DNA? DNA is present in every cell of our body and provide instructions on how to grow and function. Short segments of DNA are called genes. Genes make us all unique and affect things like hair and eye color. There are also genes which protect us from developing cancer. Any change to a gene is known as a mutation or variant. A harmful change is called a pathogenic variant. If a gene which is supposed to protect us from developing cancer has a pathogenic variant, it increases the risk of cancer because it is not working properly. Just like the genes that you inherited from your parents that affect hair and eye color, you inherited genes from your parents that protect you from cancer.
Test results and what they mean. When you have a genetic test, there are 3 possible outcomes. One is a positive result. This means there is a pathogenic variant which likely caused your personal history and/or family history of cancer. A positive result can change the recommendations for treatment for a current cancer diagnosis, and it can also change the recommended screenings and preventative options for future cancer risks. If you test positive for a pathogenic variant, there is a 50% chance your children, siblings, and parents have the same pathogenic variant. The second possible result is negative. If an individual who's been diagnosed with cancer tests negative, it means that current genetic testing technology could not find a genetic change which caused it, or would put you at an increased risk later on. In negative genetic testing, recommendations for cancer surveillance are based on personal and family history. Even if there is no genetic explanation for the pattern of cancers in your family, you and your family may need extra cancer screenings. The third type of result is a variant of uncertain significance. This means there is a change in a gene, but it is not known if that change is associated with an increased risk for cancer. Most variants of uncertain significance are eventually found to be harmless, so future management is the same as it is for a negative result. It's based on your personal and family history. Research is always being done to help us better understand these uncertain variants. Sometimes genetic changes can be reclassified to positive or pathogenic as more research is done to understand how that change impacts cancer risk. It is important to stay in contact with your genetics provider for the latest updates in cancer genetic testing.
What are the downsides to testing? Not everyone will choose to have genetic testing. One reason is that it may cause emotional upset to find out you're at an increased risk for cancer, or that you may have passed increased risk on to others in your family. For some people, it may not be the right time in their life to learn this information, or they may not be ready to learn about cancer genetic risk. Also, a person will sometimes test positive, but there may be no clear guidelines for management of this risk. Even when there are clear guidelines, the screening can be time-consuming, anxiety-provoking, and sometimes expensive.
Privacy of genetic information. Some people are concerned with the privacy of genetic information. In the U.S., there are laws preventing employers and health insurance companies from using a positive genetic testing result against you. The laws do not prevent life insurance, disability insurance, or long-term care insurance from denying you coverage, so the results of genetic testing could impact coverage or policy decisions. For these reasons, some patients obtain those types of insurance policies before they proceed with testing. Once they have this insurance, it cannot be changed because of the genetic testing results.
Why consider genetic testing? Genetic testing may help you and your family understand risks associated with cancer and can guide cancer treatment, screening, and prevention recommendations.